Hello, today is September 17, 2024. My name is Luz Garcia-Pennock, and I'm a student at Rhombus University of Counseling Psychology. The purpose of this recorded meeting is to demo a therapy session of cognitive behavioral therapy. The first part will be going through the case vignette, and the second part is going through the therapy session demonstration. Let's get started. This case vignette is about cognitive behavioral therapy. And the client is Ayan. She is a 40-year-old married Latina woman. Her and her husband have a 7-year-old daughter and a 16-year-old son. The reason for this case vignette in the therapy is because Ayan stated that she had been feeling increasingly anxious over the last 6 months when focusing on tasks in relation to her role as a mom and as a multiple property owner. Her symptoms are the following: increased heart rate, breathing rapidly, having trouble sleeping, as well as having trouble controlling worry, and having the urge to avoid things that trigger her anxiety. She has decided that psychotherapy might be beneficial for her. Why so? So Ayan is highly committed to her growth with her mindset of success and also happiness. And her therapist is Teyuk, a Mexican woman in her 50s. So I am Teyuk, and I introduce to you Ayan. Now let's get started with the therapy. Ayan, good to see you today. Tell me, how have you been feeling the past week?
Hi, I've been feeling better. I was able to go to sleep soon after I went to bed the last few days. I followed up on some tasks for my upcoming purchase of an apartment unit. I felt more focused. Getting some good sleep helped.
That's amazing. So what I hear you say is that you're sleeping better and have been able to concentrate with your work.
Yes,
That
correct.
is that's awesome. That is great progress you're experiencing. How are things with the family?
It felt good to get some good rest and be productive. My family is well. We're on task with the kids' extracurricular activities and homework.
So, what do you attribute to making your improvements?
Definitely our discussions, the mind breathing exercises you have taught me to implement are making a difference. I breathe deep in the morning and before going to sleep. And also talking through dynamics with you has given me perspective.
Oh, thank you for sharing. It's fantastic to see the improvements that you're seeing that allow you to have a good quality of sleep, family time and focus. One thing that is really key to highlight is your determination to grow because you're the one driving this, and I commend you for that. How about you partake in something to celebrate your success, your improvement, your growth trajectory? For example, it could be like treating yourself to something.
Wow, that sounds amazing, actually. I didn't think of that. But, I've been wanting to get a pedicure, so I'm feeling empowered to schedule it.
I hear you. Sounds like a great plan. So we reviewed your progress in our first part of the session and your success. So let's change gears to set the goals for today. What is something that you currently are having a challenge with, Aeon?
Well, my afternoons are hard because I'm alone in my thoughts and tend to overthink things like pending items and multiple priorities.
I see, I see. So anything else that you want to focus on?
Not at the moment.
Okay. So understood. Let's focus on that. I know, from working with you that you have a to-do list and you're highly organized. The purchase of the apartments is what appears to be causing your worry. Am I on point?
Yes, that worries me.
I see, I see. What thoughts come up when you're overthinking?
I often think about the worst case scenario. I've been worrying that the inspection of the apartments will not pass. Then my hands get sweaty and my heart starts beating fast.
Okay. Identifying your thoughts that lead to worry is in our therapy plan because those symptoms that you have, it's what's causing from a visceral perspective, your body to worry.
Mhm.
Let's discuss today a term called cognitive distortions. A cognitive distortion is a thought that causes a person to perceive reality inaccurately due to it being exaggerated or irrational. Cognitive distortions are involved in the onset perpetuation, causing states such as anxiety in what you are sharing your experience, or even depression. By our next session, you'll be able to identify those thoughts. This will, in return, bring awareness to your current thoughts that are not helpful to your situation and overall your mental health. Cognitive distortions come in different categories. Let's review those. So in front of us, we have a handout that goes over the different cognitive distortions. For the purpose of this scenario, we have reviewed them. So I'll move into the next part. At a high level, which of the cognitive distortions resonate that you experience?
I would say catastrophic thinking. So this will help me identify my thinking patterns.
Yes, it will. From what you're experiencing, as you're experiencing catastrophic thinking, possibly where you magnify your thoughts, you will be able to structure any negative thinking patterns. I appreciate your enthusiasm and determination to grow, and you're right now in a great trajectory as you have been, since the beginning. We're going to summarize our session now and then go into the handouts.
Okay.
So you are getting more sleep and you can focus more, as we've, talked about your family's doing well. And a lot of that is the mindset, the breathing exercises that have been helpful from what I understand. The aspect that we're going to work on is the excessive thinking, which might present itself as cognitive distortions, which we covered today. So what we're going to go over next is, what the sessions will look like. So before next week, the next session, you will review again the handout on cognitive distortions. And the reason why reviewing it again is because you're on your own and it will, fortify what we have reviewed today, those key points and information. You
Okay.
will also process before next week and complete a related handout on cognitive distortions. Okay, that will be able to help you understand where you are in your cognitive distortions in your situation. In an upcoming session, you will learn through questions how to reframe any cognitive distortions patterns that you have identified. So, what are your thoughts, and what questions may I answer?
You know what? I think you covered it all. I like the concept of evolving how I think. Thank you so much.
You
See you.
know, Sorry about that. It's great to see that those actions that are moving the needle, moving you forward. I just wanted to add that, these handouts are in the back of the packet that I'm going to email you. You have the first handout that we reviewed, and then
Mhm.
I'll email you the other handouts. I really look forward to seeing you next week and see your progress and your trajectory.
Thank you
Thank you
so
so
much.
Oh, yeah. We're aligned, how we said it. Thank you.
Thank you.
I'm gonna stop recording.